Is Zepbound actually more effective for weight loss than Ozempic? Hi guys, I'm Dr. Kidd, a dual-trained, board-certified family medicine physician and physical therapist who's helped thousands of patients with weight loss. And in this video, I'm going to do a review of Zepbound, and I'm going to compare it with exact numbers to other injectables such as Ozempic and Wegovy, and show you which one is actually the most effective for weight loss. This video is going to be broken down into three sections. The first of which is a brief background of the key things you need to know about Zepbound and its dual action compared to the other injectables such as Ozempic and Wegovy. This is for those who are new to the space. The second section is how much weight loss you should expect with Zepbound with exact numbers. And the third section will be, is it better than Ozempic and Wegovy for weight loss with exact numbers for comparison. So what is Zepbound? Zepbound is the brand name for a medication tirzepatide, and it's virtually identical to another injectable known as Mounjaro. The only difference is that Zepbound was studied in patients with obesity and is indicated for weight loss, while Mounjaro was studied in patients with diabetes and is indicated for diabetic treatment. Zepbound comes in 4 dosage strengths: 2.5, 5, 10, and 15 milligram. The active ingredient tirzepatide has dual actions. It's both a GLP-1 agonist and also a GIP agonist. This is in comparison to the original weight loss injectables such as Ozempic and Wegovy, which are only GLP-1 agonists. GLP-1 and GIP are both known as incretin hormones, and they're normal hormones that are released in our body when we eat. They have 2 key functions, the first of which is to stimulate the release of another hormone known as insulin, which lowers blood sugar levels, and this is why they can be used to treat diabetes. The second key function is that it reduces appetite, and that's why it's useful for weight loss. So how much weight loss would you expect when you take Zepbound? Well, there was a large study that enrolled 2,539 patients. All patients either had to be classified as obese with a BMI more than 30, or they were overweight with a BMI between 27 and 30, but they also had a weight-related comorbid condition. These patients were split into 4 groups to receive either placebo, 5 milligram, 10 milligram, or 15 milligrams of Zepbound weekly. After 72 weeks, here are the results. For those who took placebo, they still lost weight. They lost on average 3.1% of their body weight after 72 weeks. For those who took the 5 milligram dose, they lost on average 15% of their body weight after 72 weeks. For those who took the 10 milligram dose, this increased to 19.5%. And for those who took the 15 milligram, this increased to 20.9%. This graph illustrates the weight loss over the journey of 72 weeks. The top line is placebo, and the subsequent lines are 5 milligram, 10 milligram, and 15 milligram. The graph shows that there is a consistent gradual weight loss until roughly the 1-year mark where the weight loss starts to plateau. You can also see from this graph that the difference between the 10 and 15 milligram doses are minimal in terms of weight loss. So is Zepbound better than Ozempic and Wegovy for weight loss? Ozempic and Wegovy contain the active ingredient semaglutide and are known as GLP-1 agonists. So they only have one of the actions, unlike Zepbound, which has a dual action effect with 2 incretin hormones. Ozempic is semaglutide that comes in 0.5 and 1 milligram doses, while Wegovy is semaglutide that comes in a 2.4 milligram dose. Here are the weight loss results from a few different studies of Ozempic. As you can see, the results for Ozempic are more modest, with weight loss between 5 to 6% for the higher dose of 1 milligram. There was a 2 milligram dose that was actually tried. This would have been the pen just injected twice, and this was negative 6.4% weight loss after 40 weeks. Even though Zepbound had much greater results for weight loss, there are a few key differences to consider. The first of which is that different populations were studied, with Ozempic studied only in diabetic populations, while Zepbound was studied in patients with obesity. The second difference is the patients in the Ozempic studies were not told to adhere to a reduced calorie diet and increased physical activity, while this was the protocol for patients in the Zepbound studies. And lastly, the studies of Ozempic did not go as long, with the longest trial here at 56 weeks, while Zepbound went up to 72 weeks with their studies. However, even with these differences, it would appear on the surface that Zepbound may be more effective than Ozempic for weight loss. Wegovy is probably a better comparison to make with Zepbound because it was studied in the exact same patient population, and also these patients were told to have a reduced calorie diet and increased physical activity in conjunction with taking the medication. There are 2 key studies of Wegovy, the first of which was a study of 1,961 adults that went on for 68 weeks. The mean change of weight loss was 14.9% after 68 weeks. The second study went for 104 weeks of 304 adults, and there was a mean change of weight loss of 15.2% after 104 weeks. The journey of weight loss can be visualized graphically again like Zepbound, and as you can see, there was a similar finding where there's a pretty consistent weight loss until around the 1-year mark where there is stabilization of weight. As you can see, the weight loss after 68 weeks is very similar to 104 weeks. From this information, it would suggest that Zepbound is more effective for weight loss than Wegovy, with the average weight loss for Zepbound on 10 milligram being 19.5% after 72 weeks, and 15 milligrams 20.9% after 72 weeks. This is compared to Wegovy, which there was a 14.9% loss after 68 weeks and a 15.2% loss after 104 weeks. So is Zepbound more effective for weight loss than Ozempic and Wegovy? Well, from all the information that we looked at today, the answer would appear to be yes. However, technically you will need head-to-head studies to absolutely confirm this finding. So that's the review of Zepbound. If you found this information helpful, please don't forget to like and subscribe to the channel. It really helped me out a lot. If you're interested in a non-injectable weight loss medication, check out this video here on phentermine, and I'll see you in the next video.